Today we put a procedure to the test that claims to erase stretch marks in less than an hour. Let's go to Dr. Batra in the procedure room with the results. Dr. Batra, take it away.
So I'm here with Dominique Bossavy and Khamilia, and she's just finished performing a procedure similar to tattooing to camouflage these stretch marks on the abdomen. And so stretch marks are actually really difficult to treat. They're scar-like changes in the collagen and the dermis, and they can often start out very red and inflamed and then fade to a silvery white. So in pigmented people especially, we really have a lot of limitations on the lasers we can use, so this is an alternative.
Absolutely, yes. So this treatment that we've started today has actually implanted a custom blend of pigment to match Khamilia skin. And so the first treatment, as you can see, the skin has inflamed slightly, and the pigment is in. So we've removed the whiteness of the stretch marks, and in a few days, this is going to come down. The stretch mark structure will be a little bit more tight, will be tighter.
Well, because the needles are almost doing like a micro-needling collagen stimulation
yes,
effect.
and then the collagen is being reacted, and at the same time, the color that we have implanted reduce the contrast. To be successful, I like to do 2 treatments so that we build on it to make sure that it doesn't end up with the opposite, with too much color, where she would end up with a dark line.
And so if you do these 2 treatments spaced 3 to 4 weeks apart,
exactly, it's finished.
How long does that usually last?
I would say 5 years, because you can never guarantee something for life.
And Khamilia, how did it feel? How was the comfort level when you were having the procedure?
It feels fine. It probably feels like someone is maybe scratching you just a little bit lightly.
And the cost? How much would a procedure like this cost?
It depends per area. It depends on the density and the amount of stretch marks to cover, but I would say per area it starts at $1,500.
So Dr. Batra, I mean, this is an option that we have for scars. If you can't excise them or treat them with laser, then tattooing them, adding pigment is another option. What do you think?
I think this is a nice, viable alternative in pigmented people, especially where we don't have a lot of other options.
Especially sometimes stretch marks also have the groove where the skin is dented, and the effect of the needle plus the color actually smooths that out completely and even out the whole space.
Well, thank you all very much for profiling that for us.